Section 1. Introduction to diabetes mellitus. Diabetes mellitus is a chronic condition that affects the way your body processes blood sugar, also known as glucose. Glucose is vital because it's a primary energy source for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. However, having too much glucose in your blood can lead to serious health problems. Typically, there are two main types of diabetes, type 1 and type 2. Each type of diabetes has unique causes, symptoms, and treatments. In the United States alone, over 30 million people have diabetes. That's about 9.4% of the population. The disease is primarily divided into type 1 and type 2, each of which has distinct characteristics and management strategies. Diabetes is not just a health condition, it's a global epidemic that poses significant challenges to the healthcare systems worldwide. Understanding diabetes is crucial as it helps in early diagnosis and better management. Awareness and knowledge about diabetes can also prevent the onset of complications, which are often severe and life-threatening. The importance of recognizing early signs and symptoms cannot be overstressed, as early intervention can lead to better health outcomes. In the subsequent sections, we will explore more about the two types of diabetes, their symptoms, complications, and how they can be managed or treated. This understanding is essential not only for patients but also for the general population to foster a supportive environment for those affected. Section 2, Type 1, Diabetes mellitus. Understanding the basics. Type 1, diabetes mellitus, formerly known as juvenile diabetes, primarily affects children and young adults, but it can develop at any age. It is an autoimmune condition where the body's immune system attacks the insulin-producing beta cells in the pancreas. This results in the body producing little to no insulin, a hormone that is essential for glucose to enter cells to produce energy. Without insulin, glucose accumulates in the blood, leading to high blood sugar levels. The exact cause of type 1 diabetes is not known, but it is believed to involve a combination of genetic and environmental factors. Symptoms often develop quickly and can be severe. They include increased thirst, frequent urination, hunger, weight loss, blurred vision, and fatigue. These symptoms occur because the body starts to break down fats and muscle for energy, leading to a condition known as ketoacidosis, which is potentially life-threatening if not treated immediately. Diagnosing type 1 diabetes involves measuring the blood sugar levels in various circumstances and checking for the presence of autoimmune antibodies. Early diagnosis is crucial as it helps in managing the condition before it causes irreversible damage to various organs. Patients with type 1 diabetes need lifelong insulin therapy and must regularly monitor their blood sugar levels. Proper management of type 1 diabetes also includes maintaining a well-balanced diet, regular physical activity, and regular medical checkups. These steps are essential to prevent the complications associated with diabetes, which we will discuss in later sections. Section 3. Type 2 diabetes mellitus, a closer look. Type 2 diabetes mellitus is the most common form of diabetes, affecting millions of people worldwide. Unlike type 1, type 2 diabetes is primarily characterized by insulin resistance, where the body's cells do not respond effectively to insulin. Over time, the pancreas cannot make enough insulin to overcome this resistance, leading to elevated blood sugar levels. This type of diabetes is mostly seen in adults over the age of 45, but recent trends show an alarming rate of occurrence in younger ages, including adolescents and children. The risk factors for type 2 diabetes include obesity, a sedentary lifestyle, poor diet, and genetic factors. Symptoms may be similar to those of type 1, but are often less marked and can develop slowly over time. Some people with type 2 diabetes may not notice any symptoms at all, which can lead to a delay in diagnosis until complications arise. The management of type 2 diabetes focuses on lifestyle changes such as improving diet, increasing physical activity, and losing weight. Medications may also be prescribed to help manage blood sugar levels, along with regular monitoring. It is also crucial for patients to undergo regular screenings for complications.
Educational programs and support groups can be invaluable for individuals with type 2 diabetes. They help patients understand their condition, manage their symptoms, and maintain a quality of life. Awareness and proper management are crucial, as type 2 diabetes is a major contributor to morbidity and mortality worldwide due to its complications, which we will explore next.
Section 4. Diagnosis of diabetes methods and criteria. Diagnosing diabetes is critical for early management and prevention of complications. The diagnosis of diabetes can be made through several methods. The most common tests include fasting plasma glucose (FPG) test, the oral glucose tolerance test (OGTT), and the A1C test, which measures average blood sugar levels over the past 2 to 3 months. Each of these tests has specific thresholds that must be met for a diagnosis of diabetes to be confirmed. The FPG test measures blood glucose in a person who has not eaten anything for at least 8 hours. It is easy to perform and less expensive than other tests, making it a common choice for initial screening. The OGTT, on the other hand, measures blood glucose after a person drinks a special glucose solution and provides information about how their body processes glucose over time. The A1C test is particularly useful because it does not require fasting and provides a longer-term indication of blood glucose control. This test is increasingly used not only for diagnosis, but also for the management of diabetes, as it helps track the effectiveness of the treatment plan over time. Additionally, random plasma glucose tests can be used in cases where symptoms of severe diabetes are present, regardless of when the last meal was consumed. It is vital for individuals at risk of diabetes to have regular screenings, especially if they have prediabetes, which is a condition where blood sugar levels are high but not high enough to be classified as diabetes. Early diagnosis and treatment can drastically reduce the risk of developing serious complications, which we will address in the following sections. Section 5. Microvascular complications of diabetes. Microvascular complications are those that affect small blood vessels, and they are commonly seen in prolonged cases of diabetes. These complications can have severe outcomes if not managed properly. The primary types of microvascular complications include diabetic neuropathy, nephropathy, and retinopathy. Each of these affects different parts of the body and can lead to significant health issues if left untreated. Diabetic neuropathy refers to damage to the nerves caused by prolonged high blood sugar levels. It can cause a variety of symptoms, including pain, numbness, and weakness in the feet and hands, which is often referred to as peripheral neuropathy. In severe cases, neuropathy can lead to digestive problems, urinary tract issues, and even cardiovascular anomalies due to the autonomic nerves being affected. Diabetic nephropathy is another serious complication that involves the kidneys. High blood sugar can damage the delicate filtering system of the kidneys, leading to chronic kidney disease or even kidney failure in advanced stages. It is one of the leading causes of dialysis in many countries. Regular monitoring of kidney function through blood and urine tests is crucial for people with diabetes. Diabetic retinopathy involves changes to the retinal blood vessels, potentially leading to blindness. It is one of the most common causes of vision loss among people with diabetes and a leading cause of blindness among working-age adults. Early detection through regular eye exams can prevent severe vision loss and is an essential part of managing diabetes. While these complications can be daunting, the advancement in medical treatments and proactive management of blood sugar levels can significantly reduce their onset and progression. This highlights the importance of regular medical checkups and adherence to a diabetes management plan. Section 6. Macrovascular complications of diabetes. Macrovascular complications involve the larger blood vessels and include conditions such as cardiovascular disease, stroke, and peripheral artery disease. These complications result from the damaging effects of prolonged high blood sugar levels combined with other risk factors, such as high blood pressure and cholesterol, which are often present in individuals with diabetes. Cardiovascular disease is one of the leading causes of death in people with diabetes. They are at a higher risk of developing heart diseases and strokes, because diabetes accelerates the development of clogged and hardened arteries. Symptoms can include chest pain, shortness of breath, and in more severe cases, heart attack. Stroke is another significant risk for diabetics. It occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Symptoms of a stroke can include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking, and loss of balance or coordination. Peripheral artery disease, PAD, involves narrowing of the peripheral arteries to the legs, stomach, arms, and head. In diabetes, PAD most commonly affects the legs and feet. Symptoms may include leg pain when walking, leg numbness or weakness, coldness in the lower leg or foot, and sores that won't heal. PAD can be severe and lead to critical complications if not treated properly. Management of macrovascular complications involves controlling the overall cardiovascular risk factors through lifestyle changes, medication, and in some cases, surgical interventions. Regular cardiovascular assessments are crucial for early detection and management of these risks. Section 7. Living with diabetes. Tips and strategies. Living with diabetes requires adjustments, but it is manageable with the right strategies. First and foremost, education about the disease is essential. Understanding diabetes allows for better self-care practices and decision-making. Diabetic patients should be encouraged to attend educational programs that teach them about their condition, dietary needs, and the importance of regular physical activity. Diet plays a crucial role in managing diabetes. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help control blood sugar levels. It's also important to monitor carbohydrate intake and understand how it affects blood sugar. Meal planning can be a helpful tool in maintaining a healthy diet. Regular physical activity is another cornerstone of diabetes management. Exercise helps to lower blood sugar levels, boosts overall fitness, and can help manage weight. It doesn't have to be strenuous. Even regular walking can be highly beneficial. Patients should aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity a week, along with muscle strengthening exercises on 2 or more days a week. Finally, maintaining regular contact with healthcare providers is crucial. Regular checkups allow for monitoring of blood sugar levels, early detection of complications, and adjustments to treatment plans as necessary. Mental health support should also be part of diabetes management, as dealing with a chronic condition can be stressful and may lead to depression or anxiety. Section 8. Conclusion and Call to Action. Diabetes. Mellitus is a significant global health issue with severe complications if not managed properly. Understanding the types of diabetes, recognizing the symptoms, and knowing the complications are crucial steps towards effective management. The information provided in this essay serves as a foundation for understanding diabetes and emphasizes the importance of early diagnosis and proactive management. It's a wake-up call for those who might be at risk but are currently unaware of their condition. If you or someone you know is experiencing symptoms or falls into a high-risk category, it is essential to seek medical advice and get tested. Early intervention can make a significant difference in managing diabetes and preventing severe complications. For those diagnosed with diabetes, remember that with the right knowledge and tools, you can lead a healthy and active life. Education, lifestyle changes, and regular medical care are your best defenses against this disease. Take action today for a healthier tomorrow. This essay aims not just to inform, but to inspire action. Whether you are at risk, newly diagnosed, or have been managing diabetes for years, there is always more to learn and ways to improve your health. Let's continue to support each other in this journey and strive for a world where diabetes can be effectively managed and eventually overcome.